Doctor, coming to the treatment part, what are the treatment modalities of diabetes?
See, initially when a person is diagnosed to be a diabetic, as I just said earlier, we advise we make him understand the disease, and if it is pretty high, if the sugar levels are very high, any type of diabetes, if the blood sugar level is uncontrollably high, I would personally suggest the person to be on insulin for at least a couple of months, then revert back to oral tablets, and then give him a trial of lifestyle modification. If this is just to curb the glucotoxicity, for example, if the sugar levels are 300, on diagnosis 300, 340, and then he is associated with other symptoms, it is to curb the glucotoxicity, we start on insulin. Now, the advantage of starting insulin, early initiation, advantage of starting insulin on diagnosis is it will preserve the residual beta cells. It will give rest to the beta cells, and then after a couple of months the beta cells regain their ability to produce insulin. You give rest to the beta cells. That's the whole idea of starting insulin initially. Later on, there are many patients whom we have started on insulin initially, and then we have completely stopped the patient of tablets or insulin. They are just on lifestyle modification and diet. That's it. No tablets, no medication, but you have to adhere to diet and exercise. That is, this is for patients with high glucose level on diabetes. But then there are patients who've got impaired fasting glucose, if the sugar levels are about fasting sugar levels are somewhere about 126 and above, and your postprandial somewhere about 170, 180, that is impaired glucose tolerance. You can advise them just plain diet and exercise. That's enough. I mean, keep on monitoring the sugar levels every 2 months or every month as per the patient compliance, and then advise them on the importance of diet and exercise, and that should be okay.